Good afternoon, everybody. Today, we are going to talk about early and subtle signs of autism in babies and toddlers. The first one I'm going to go into is lack of eye contact. This, to most people, this would sound like an obvious sign, and a lot of times it is. But sometimes it will be very subtle. A normal developing baby typically seeks eye contact with their parents, especially when engaged. A baby, they might be looking at a toy, but as soon as mom or dad walks into the room, they will turn their head to look at the parents. Okay? But in a child that is at risk or might have autism, the parents might walk into the room and the child may either continue staring at his hands or staring at a toy, and they will not look at their parents right away. They might eventually, but this is the difference in the typical child without autism and a child that may be at risk. They may have, this is a sign of early onset of autism. Now, toddlers with regressive autism will show a gradual decline in the frequency and intensity of their eye contact with the parents. You should not have to engage your child to get eye contact. If you have to engage your child, that is a warning sign. Now, side glancing, I talked about this a little bit in the last video. A baby might show some early side glancing behavior. This is when they study the object up close by looking at them sideways out of the corner of the eye. This is because, or this is what we have learned, that the brain maybe can't register visual pictures from the central part of the brain in children that have autism. Now, focusing on spinning objects. This is very typical for children that are at risk or have autism. Fans and wheels are fascinating for children with autism. They may stare at a ceiling fan. They may spin wheels on toy cars and stare at them up at close. They even might remove them and let them roll across the floor. They may push a toy truck back and forth, but they are fixated on the wheels, not on playing with the car itself. Now, lack of babbling. Babies should develop a vocal laugh by 3 months. They should be cooing and gooing by 5 months. They should start babbling with consonants by 7 months and begin starting baby talk by 9 months. These are all the stages that a baby will go through to prepare himself for those first words by 11 or 12 months up to 15 months of age. Now, I have seen babies that miss these milestones, but then go on to develop perfect speech. So having a non-babbling baby isn't necessarily a cause for concern. But if a baby has this and other subtle signs, this is a time to be a little bit concerned, and you should bring them to your pediatrician's attention. Now, if they have no words by 18 months. Now, normal language development usually goes like this. 2 words around 12 months, 6 words by 15 months, 10 words by 18 months, and numerous words with 2 phrases beginning at the age of 2. The child should be using these words without prompting, such as if you say close the door and he says close the door. Repeating the words do not count. We are counting words that the child will do without any prompting. Okay? Now, if your child is not having the proper speech, a lot of parents will come to me and saying, our child had no words by 18 months, and when he was 2, we took him to a therapist, and the therapist told us maybe he has autism. Okay, at this point, you had some obvious signs. Now, I believe myself that it's better to take a young child to speech therapy if he is delayed and start the therapy instead of waiting till the child is 2. Because if you've waited that long, you've missed a window of a developmental opportunity. Now, solo play. Some toddlers love to play alone, and that's really okay. But at the same time, these same toddlers should have, they should crave and seek out play with other children. Um, Now, they will look for siblings to play with, friends at nursery, or something like that. Now, if a child who likes to play all the time and he doesn't want to play with anyone, this is a time that you as a parent really should be concerned. Now, we have the next one we call it parallel play. Some kids will appear to play happily with other kids when they are actually playing alone, and this is something really to observe. A child may be even mimicking the other kids rather than actually engaging and playing with them. For example, you may have 3 kids playing with cars. 2 of the kids are going voom, voom, voom with their cars and crashing into each other and racing each other. But one is just sitting there and not engaging with the other kids around him, but he's going voom, voom, voom with his car. Okay, this is another thing, if you observe, you should be concerned about it. The next one I will go into is a lack of engagement with new people. Whenever a new person walks into a room, a typical child will look at the person, okay? They typical look at that person, they check them out, they catch their vibe, determine if the person is okay or not, and they will either go back to play, doing what they were doing, or they may engage with the person, or they may run to mama or daddy for protection. Now, an at-risk child will usually show one of 2 reactions. Either he will have an unusual degree of fear and anxiety, or he will not acknowledge the new person at all. They will just completely ignore that they have walked into the room. Now, obsession with certain toys. Trains and cars and more cars. An at-risk toddler tends to be obsessed with certain toys. It's often trains or cars, but it can be actually any kind of toy. It's usually a car with wheels. Now, I'm not saying that every child hooked on a certain toy is a concern, but this is probably one of the pieces of the puzzle. Now, they play inappropriately with their toys. Toddlers should learn that cars go vroom, dolls are fed and cared for, action figures move and act out imaginary scenes, and balls bounce and roll. A child that is at risk may not play in this manner. He may line up the cars and stare at them from different angles for a long period of time. They may drag the doll around by the foot as if it's not a real person. Okay? They may hold the ball and look at it and stare at the vibrant colors, but not bounce it or roll it or actually know what to do with it. Now, we have repetitive movements, what I've gone over a little bit in the other video. Children may perform certain actions over and over again, such as turning the lights on and off, opening and shutting the doors and banging them, rewinding CDs to watch a movie over and over again, or even to just watch a certain scene over and over again. The list just goes on and on. Also, they use body movements like rocking back and forth, um, flapping their hands, shaking their legs. All of these types of things are called stimming. Now, usually in stimming with the body, this is to self-regulate and to calm the child down. This can actually get better with occupational therapy. And when you see this, in your child, it is a area of concern as well. Now, unusual sleep patterns. We've all known kids that wake up a couple times a night. Typical kids can be mothered back to sleep by their parents, or fathered back to sleep. Now, many kids with autism can sleep just fine, okay? But a lot of toddlers with autism will wake up in the middle of the night and they won't go back to sleep for hours and hours and hours. It is very difficult to settle them down for the night. They may stay awake till 2, 3, 4 o'clock in the morning. They will not accept on consolation from their parents. They will not lay down with their parents to go to sleep. They might get up in the middle of the night and start playing with their toys. Parents that have children that have these sleep issues are usually very sleep deprived. Now, if you see that your child has this issue in sleep, this is also another area you need to be concerned about. Our sensory problems. We call children that have we call the sensory issue sensory processing disorder. Okay, it's also known as sensory integration disorder. It's a condition where the baby or child doesn't react to sensory sensations such as touch or sound in the typical manner. One of the earliest signs may be a baby who doesn't like to be snuggled or hugged or cuddled. They usually squirm and fight to get out of this position. They like to be open and free. They like to be held upright instead of, cuddled. They may get extremely upset when this is usually with older kids or older toddlers. They will get extremely upset when their hands or face may be sticky or dirty. They may refuse to walk barefoot on grass or sand on the beach. They don't like when their socks aren't perfect or their shoes aren't put on, in the right way. Clothing and tags seem to annoy them and irritate them and may itch. Some of the clothing make them itch. Some kids may be overwhelmed by sounds, such as a party in a play area where there's lots of loud sounds and kids. Some kids may show the opposite reaction to some sensations. For example, some kids crave deep pressure. They love to be hugged and squeezed. They enjoy deep pressure on their stomach or head. Um, they may enjoy pushing their head into a couch or a pillow or even against mom or dad. All of these signs I have mentioned might seem obvious to people, but they can be very subtle, and often parents don't notice them until they actually look back after the diagnosis has been made. Typical children may show one or two of these signs in early childhood, but as they mature past and go into a new milestone period, um, these symptoms will go away, such as walking on the tiptoes. This is common during early childhood, but as they reach the age of, say, 5, 6, 7, this typically stops. Okay? By understanding the action and acting on these during these indicators, the at-risk for the at-risk infant or toddler, your doctor can begin intervention at a younger age. So this is very important to note that these kids, they need some kind of early intervention to help with these types of issues. Okay, now we're going to move on to Module 4. This is subtle signs of autism in older kids. Thank you for listening, and I hope you have a great day.